Welcome to another episode of Conversations with Women Trailblazers. This is your host, Dr. Carmen Landrau, and today our host is Dr. Maiysha Clairborne. She is a physician, thought leader, consultant, and master trainer of Neuro-linguistic Programming. She's also the founder of the Mind Remapping Company, where she helps individuals and organizations better understand trauma. Dr. Maisha focuses her work on helping leaders create an inclusive and safe environment where her colleagues and employees feel seen, heard, respected, and valued, and also fosters increased productivity, engagement, and retention in their organizations. Welcome aboard, Dr. Maisha.
Thank you so much, Dr. Carmen. It's so good to be reunited with you. I know it's been a while. You were on my podcast, one of my previous podcasts, and it's good to be back connected. We're going to have to get you on the most recent podcast.
That's fantastic. And yes, we met a few years ago.
We did.
We met a few years ago, and I think twice in your podcast.
Yes.
If I'm not mistaken. Oh, wow. And now it goes full circle. Now you're mine, and I'll be glad to go back to your new podcast. That would be fantastic. For those who don't know, Dr. Maisha is a fantastic physician, but she's also, like I said, she's also an expert in neuro-linguistic programming. So we're going to have a show for you today that's going to be, like I want to say, very juicy. It's going to be very interesting for those of you who like that kind of topic. So yes. I want people to get to know you. Can you let us know, how were you as a young girl?
Oh my goodness. It's interesting. I think that my family would describe me as quiet and reserved. But when I was not around my family being quiet and reserved, I was actually very animated and very silly. I remember now I'm a Gen X, so I grew up, in the 80s. And I remember when MTV started, before BET, when MTV started. So, we used to rock to like Twisted Sister and Cyndi Lauper. And when R&B came out, we formed these girl groups. I used to go to the Boys and Girls Club of Huntsville, of Alabama, in Alabama, and we would do these make up these dances. So I was like very, very animated and very silly as a girl. But then when I was in the house, I think I was quiet because the rest of my family was loud. So there was that. So I just hung back. I think that's probably the best way to describe me. And I think more so than anything, with all of that, I was very focused on my grades. So I was always a straight A student. I was always getting along with my teachers. I think that probably I describe myself as the golden child in front of the adults and a silly child in front of my friends.
That is so interesting because people sometimes say, oh, I'm an extrovert or I'm an introvert. I think you probably were an ambivert, depending on where you were. Is that correct?
Very much so. And still to this day, I mean, when I test, technically I test on the introverted side, and I do fulfill a lot of the introverted qualities. I mean, I love the company of myself. I love quiet, but I also love people. And in one-on-one and in small group conversations, I really love to go deep and have fun and be silly. So I think to this day, I probably am on that ambivert scale.
Amazing. That's amazing. Could you tell us a little about your professional background?
Sure. Now, I went to Emory University. I'm in Atlanta, Georgia, and my undergraduate degree is in psychology. So what I can tell you is I always have loved the brain. I've always loved human behavior, and perhaps it came from my childhood upbringing. Part of that upbringing, I was a witness to domestic abuse and domestic violence, and so there was always this why. Why do people act like that? Why do people do the things they do? And when I took my first psychology class, I just fell in love. And so I almost went down the route of being a therapist, but I loved the body too much. So I went to medical school. I have an MD, and I went to a family medicine residency because I just couldn't choose between the specialties. I mean, I really loved pediatrics and women's health and, the everything in between. I loved procedures, but I didn't love surgery. So that family medicine gave me that well-rounded training. But at the end of the day, I was very interested in getting to the root cause of disease, of illness, of unwellness. And so I went into integrative medicine. And that psychology and that behavioral part actually came full circle because I became a coach. And inside of that, I found neuro-linguistic programming and I found hypnosis. And so all of that interest in the brain came full circle. And I did that work in my private practice for 10 years before I transitioned out and said, you know what, I want to do something bigger. I didn't necessarily burn out in medicine, but I just felt like I wanted to make a bigger difference. So I started to coach women in medicine, moms in medicine who were burned out, led to career transition. And then because most of the work I did was with mindset and with communication, I decided to go ahead and become a trainer and a master trainer of NLP. And then we knew the pandemic happened. And so when the pandemic happened, it shifted things for me in the way I still loved teaching about this work, but I felt like there was a way that I could marry the activism into it. And so I started to do work in equity, diversity, inclusion, became an anti-racism educator, really started to get deep and more into the brain around trauma and psychological safety. And what I do now is I fill that skill gap. So I still teach the tools of brain-based communication, which I call neuro-linguistic programming. But in organizations, I went into organizations to fill the skill gap that is between knowing about what DEI is, knowing about what psychological safety is, and actually being able to apply it day to day in interpersonal interactions. Because I do believe that if we're going to create safe spaces, we have to be safe spaces. And I think that's what a lot of leaders and organizations, that's the missing link that's there.
That's impressive. And I find it extremely curious that you're so interested in the brain, but you did not necessarily go into psychiatry because it would
Yes,
have been like the logical move.
it would have. And I considered it. Here's the thing. I think that there's a part of me that thinks that if I had known then what I know now about the possibilities of psychiatry, I would have gone down that route. But what was shown to me about psychiatry was that it was a specialty that only prescribed medicine. And I was clear that if I was going to do something like psychiatry, I wanted to learn how to do therapy, like the actual cognitive behavioral type therapeutic interactions with patients. But that wasn't modeled. And so that's why I ended up choosing family.
That's great. And it was a very helpful move. And I say helpful for the patients because
Mhm.
as a primary care physician, people come to you first.
Yes.
Women will come to you not necessarily for psychological issues, but
Mhm.
when you're interviewing the patient, when you're examining them, you may
Mhm.
find hints here and there of things that,
Yes.
hey, red alert, something's happening, and you can
Mhm.
offer the help by being a physician who's also interested in how the brain works and trauma. I
Mhm.
think it's beautiful what you've done and how you put it together. And before
Thank
I go
you.
ahead, for the benefit of everybody that's listening to us, I want you to let us know, what do you mean when you say neuro-linguistic programming? And
Mhm.
also when you mean psychological safety. Could you explain those to us?
Absolutely. Let's start with neuro-linguistic programming, and I'll touch a little bit on hypnosis too, because I know people kind of, when I say hypnosis, they're like,
Are
so,
we going to fall asleep here? What is she
like,
going
huh?
to do to me?
What? She
Are
gonna
you
be
going to
about? She
make me
gonna
do
mind
things?
control me? No, we're not gonna do that. So neuro-linguistic programming, if we were to break it down, neuro just refers to our brain and our nervous system. So when we talk about the neuro, it's like how our brain receives information, how our nervous system receives information. And then when we talk about linguistic, that's our language, how we encode and create language. And a lot of times we think in pictures and then we encode into words. So it's the encoding that is our verbal and our nonverbal language. And then the programming really is the programs that run in our head. So a lot of people think, oh, you're going to program me. But no, we already have enough programming in our heads. We run unconscious programming all the time. And so there's the programming that we have that works and the programming that we have that doesn't work. And what neuro-linguistic programming does is it uses language and the brain and the nervous system to look at what are the programs that are not working. And we use different techniques and tools and language patterns to help shift from unhelpful thinking or unhelpful programming to programming that gets you where you want to be and helps you to be the best self that you want to be. So that is the essence, in a nutshell, of neurolinguistic programming. Now, when I talk about hypnosis, just touching on that, hypnosis is just this space of being in a trance. And we've all been in a trance. We've all been in a trance before. You meditate, you're in a light trance. You're driving down the street and you're in deep thought and you miss your turn, you're in a trance. You're watching TV and you're in the program so much that you can't hear the person outside the door calling you, you're in a trance. So we've all been in a trance. And what hypnosis is a facilitated trance, a little bit deeper, that allows for the practitioner, it's in a controlled setting, allows for the practitioner to help release negative emotions, release limiting beliefs, and to be able to replace them with more empowering messaging to the subconscious mind and into the subconscious space. So that's what hypnosis serves to do. And there's a whole conversation to be had about that, but I'll leave it at that for the purposes of this conversation. And then that, moving on to psychological safety, first of all, we all need to feel safe. And when we think about feeling safe, a lot of people think about the physical of feeling safe. But if you ever have been in an interaction with someone where you trust them to a point, right? You may there are certain people you may trust completely and utterly. You have a level of complete safety and trust with them psychologically and emotionally. But then there are certain people where you'll tell them or you'll open up to a point and there's something that stops you. There's a limit to the amount of psychological and emotional safety that you have with them. So it's the level of safety that you feel, whether you feel included, whether you feel safe that you can make mistakes and learn, whether you feel safe that you can challenge the status quo and step outside of the box. It's that level of mind, the safety of the mind or safety of expression that we have. That's the essence of psychological safety.
That's very helpful because, curiously, just today I was reading an article on eggshell parenting. Because sometimes we think about psychological safety. The first thing, at least for me, one of the first things that come to my mind is domestic violence. You know, the relationship with your partner and how, you know, how that could be. But also, parenting is an area where we may or may not necessarily realize it. Are our kids safe? Do they feel safe with us? Do they feel safe at home? Do they have a safe environment? It doesn't have to be only the people. I think also the environment, because if you live in an area where there's a lot of criminality or there's you don't have a safe home, things like that, it can also affect you. Is this correct?
Yeah, and like especially even if the area is relatively safe, but the home is chaotic, the home is messy, or if there's chaos in relationship, like the child is witnessing chaos, even if it's not violence, it's chaos. That in and of itself can be traumatic. And I think we think about trauma as, the big events, right? The big and the very horrible events. And what people don't recognize can be traumatic, which can ruin psychological safety, is the small, multiple, repetitive intensities, the small, multiple, repetitive things that happen that take away trust, that take away consistency, that take away that structure that help for people to be saved.
Great. Let us know, give us a little bit of a journey throughout time, because I have seen some transition from a distance, because we still have to meet in person. If you don't believe it, we get along really well somehow, and we haven't met in person yet. That has to happen. First of all, that will happen. We will make it happen. But give us a little bit of a view of what has been your journey throughout time when you decided first to be a business owner, creating this fantastic business that now you have, and to this day, what has happened throughout the time?
I I think that from the time I was in residency, I realized that I was probably unemployable. So, right. So my mom, I call her the OG entrepreneur in my life. She's a retired dentist. So I'm a legacy. My mom is a retired dentist. My dad is a retired OBGYN. They were divorced, so they were in two different places. But, I think I had a little DNA model going on. But I worked in my mom's private practice. So she started her private practice from nothing. She built up a dental practice. She opened a second one. And I had the privilege and the opportunity to work inside as her dental assistant. So I got to see her run things and how she ran her business. And I think that imprinted something in my mind about the freedom of entrepreneurship. So when I did go to medical school and go to residency, I think I was pretty clear that I would have my own practice. And I had this like fantastic vision of owning a big wellness center and absolutely no business knowledge at all. So,
Isn't that how we do
so
it?
this is how we do it, right? And so when I was in residency, there really was like this feeling of constraint, people telling me what to do and how to do it all the time. And I saw this sort of opportunity in being my own boss to be able to create a practice, create a wellness center that served patients in a way I felt would best represent me, but also best help the patient holistically. And so when I first came out of residency, I started a practice. Started a practice for those who may not be who be listening but not watching. I'm doing my air quotes. And I rented a room in a chiropractor's office, and I knew nothing about marketing. I threw up a website, and within 4 months, that practice failed. I couldn't sustain it. And the chiropractor was like, yo, you can't stay here. And he kicked me out. And I was like, really? And so I did for a couple of months, I did some home visits. And that wasn't sustainable in a big old city like Atlanta. I was driving all over the place and I was undercharging, way undercharging. And so I went back to locum tenens and I went back to the drawing board. And for me, it wasn't a matter of failure. It was just a matter of, okay, I got to learn how to do this right. And so the second time around, which ended up being 2 years later, I rented a space and I still didn't know much about business, but I knew a little bit more about business and got it started. And I pounded the pavement. That was in 2007. That was before, social media was like really a big thing. Maybe it was back in MySpace days, but it was before, social media ads and everything was the yellow pages and, print ads and paper business cards. And you
Snail mail.
drove up and down the street and knocked on doors and introduced yourself. And that's what it was like, that first, I don't know, 5 or so years of practice. And even as time went on, and I will say, you said this earlier, you said, it was being an entrepreneur can be lonely. And it was because I was doing integrative medicine at a time before it was well known, before it was popular. And unfortunately, my colleagues in the space were looking at me like, what are you doing, little girl? Like, you're weird. This is quackery. And so, in order to preserve my own mental health, I had to isolate, or I chose to isolate myself from my own professional colleagues. And I had to find adjacent colleagues, like other chiropractors or massage therapists or other, holistic professionals that were happy to see me as a physician doing this kind of work. And that's how I built my practice, on referrals, on relationships from people who weren't necessarily in my profession, but were in adjacent professions, and, cultivated a community around that. And so what was very interesting is when I just did decide to transition out, I had to reconnect with the physician community, which was actually very scary for me, because it was a community that I didn't feel safe with.
Absolutely.
Talk about psychological safety. And fortunately, because I was speaking into a problem that was very real, burnout, then these physicians sort of flocked to me, and it helped me to come back to an understanding that, they, and I say they, not apart from myself, but at the time was like, oh, these people are people too. they were people with a different understanding than than I had, and that I was a little bit out in front. And some maturity, some age and maturity helped me to be quite forgiving and compassionate. And so once again, though, stepping into the world of burnout coaching at a time when it was early in the conversation, it was tough because psychiatrists, I'm a family doc, psychiatrists were like, what, coaching? You're not a psychiatrist. Like, what are you doing? Physicians in general were like, coaching, I don't need coaching. What the heck is this? Right. And there was a lot of education that needed to happen. But then when they saw that I transitioned my career, they were like, how did you do that? And then I could say, well, let me show you. And what I started to see was that a lot of what was holding back physicians from being able to, especially my mom docs, my mom and my women docs, was their own mindset. And I really started to see the conditioning that our industry has laid upon us that has led us to the condition that we are now in as a community of physicians still, right? And so that it in that place, I began to connect more with the community. And I, even though it was still scary because I still wasn't sure like who I was safe with and who I wasn't. And the more physicians that started to step into entrepreneurship, I wanted to collaborate. I wanted to play in the sandbox. And there were some physicians that were open to it, like yourself. And there were some who would pretend like they were open to it, but they were really like frenemies. And so then I had to gain a discernment. And so a lot of this was it was a lot of, trailblazing, but also was painful. It could be painful at times. It was very hard because I had to like overcome my own fear of reaching out and my own and learn like to discern people and thicken my skin. I mean, I thought I had thick skin as an entrepreneur, knocking on doors and being told no. But I think when you open your heart to your community in with intentions of wanting to collaborate and play together, and people sort of start to let you in, and then let you know that they're untrustworthy, that can be very painful. So anyway, it just got me deeper diving and threw me into deeper compassion and really helped me to dive deeper into the trauma aspect of it so that I could be healed as well as impart that healing and share that healing with others. And at the end of the day, when the pandemic hit, you know, I'll say two things. I'll say I felt grateful that I was no longer on the front lines. And at the very same time, I felt guilty. And I felt, how can I help? There was like this swirl of emotion around it. It's weird because like kind of like getting emotional now. I'm like, wow. And I appreciate you for asking me to recount this because I don't think I've ever really talked about it in this way. And so yeah, I was able to sort of experience my own trauma, but also be compassionate and hold space for others' trauma during the pandemic, during the isolation and the mental health, during the racial tensions, and there was just a lot of things going on, and then there came a time where I said to myself, and this is, Dr. Carmen, I never thought I would go corporate. Like I never thought I would be the one to step into the corporate space because I always felt, well, I'm trying to get people out of that space and I feel like it's so toxic inside of that space and I don't know that I have the bandwidth or the capacity. But when all of this stuff happened around 2020, 2021, 2022, I realized that that's where my place was and that the biggest impact that I can make is going in and impacting the people who were the decision makers and not necessarily changing their minds, but giving them a bigger perspective, a bigger view, so that they could change their perspective and their own minds would be changed of their own volition. Right. And so that's kind of like the timeline. That's how I've gotten to where I am. And it's It's the first time I've recounted in that way, and I thank you for asking me that question.
Oh, and I thank you for sharing it. And you're the poster child of a woman trailblazer, because what you've described now, you just said it. You're doing something that nobody else had done before, or at least that you knew. So you
Mhm,
have to figure it out along the way.
mhm,
Lonely. Yes, and it's happened to me, and all these women that I know, they'll tell you the same story. I'm so excited and I want to let everybody know. And then what happens? Those closest to us, they hurt us the most sometimes. Whether it's
mhm,
your family, your friends, or the people who work with
mhm,
you in your industry, at
mhm.
times I don't want to say they don't believe in you, but they want you to be cautious because they don't want to see you hurt. But
Yeah.
also there's people out there who'll tell you, are you doing that? You see the chuckle.
Mhm,
And I remember when I started in professional speaking, and I remember this person in particular who said, the tone, they use. So are you now a motivational speaker? Um, and honestly, that person has come to me more, I would say, at least 10 times asking for advice, business advice.
mhm, mhm.
So when they see you succeed, um, I think it lets them know, okay, she's real, but you have to basically prove yourself.
Yeah.
Um, because there's that cynical aspect of, especially in medicine, there's that cynical aspect because once
Mm,
you're a doctor, what else is out there? I've reached the top and I don't need anything else. But the reality
mhm.
of our life as physicians is that it's very tough.
Yeah.
Um, just like you said, we're trained to take care of patients. We're not
Mhm.
trained in business.
Yeah.
At least I
Yeah.
wasn't trained. I know you were not trained.
Exactly.
We have to figure it out, and we
Mhm,
are trained to succeed. We are trained to help the patient have a
mhm,
good quality of life, come out. Even if they're super sick in ICU or the ER,
mhm. Yeah.
we still want that patient to come out, go back to their family members, and have a lead a successful life. We're
Yeah.
not used to the failure, the constant failure, and
Mhm.
sometimes we take it personally when we shouldn't, because
Right.
and I think this is where now you come along with psychological safety. That's why I see that what you're doing is so important.
Yeah.
um, but I have to thank you for sharing this story, because you said so many truths out there, and that's the truth. And I'm glad that people are now seeing you as a resource to them. Physicians
Mhm.
are seeing you as, okay, there's a Clairborne out there. I'm experiencing burnout, or I want to go ahead and take a leap of faith into another industry, or whatever it is that they're living. They
Mhm.
can see you as someone that they can tap into and say, okay, can you help me? Can we work together?
Yeah.
That's amazing.
Yeah, absolutely.
And I thank you for sharing that story. I mean, it's super, super amazing. Thank you for doing
Thank you. Thank you. And it's interesting because no matter, I think that, my karma is trailblazing, because even now in corporations, whereas we talk about this psychological safety, it was funny when I first started to talk about it. And I was talking with the CEO of this educational company, and he was saying, psychological safety is just now is just now being talked about in healthcare. And I was like, you got to be kidding me, really? I'm like, again with the trailblazing, but then it's like that's my karma. And I think that honestly, unconsciously, it's what I seek out. It's a thrill for me to be in the space talking about what nobody else is thinking about. Talking about bringing ideas in ways that people are not thinking about, right? How do you fill the gap? People say, "Oh, well, this is what you do to do psychological safety. You do bonding exercises and team retreats." And I'm like, yeah, but
more to
what
that.
about the personal development? And they're like, really? What about listening? Listening. I mean, it seems so simple, right? To listen, but it's not obvious. And so that's what I talk about. Well, maybe if we work on how we listen, and we start to then when we work on how we listen, because the listening drives the communication, then we can start to learn how to communicate to create trust. And so it's like these little things that people are thinking about, making it so complex and so convoluted, where I like to take it back to basics. That's where the gold is for me. And that's the it's still baffles me that in of itself is the trailblazing conversation.
And I'm sure they appreciate it, because
Yeah.
as basic as it sounds, it's still one of the
Mhm.
most important aspects of communication,
Indeed.
definitely.
Yeah.
Dr. Maisha, I want to thank you for being a guest. And I want to let our audience know if they want to get in touch with you, how can they reach out to you?
Absolutely. Well, so if you're on social media, I am on LinkedIn. That's my favorite platform. And I'm also on Instagram and Facebook, so you can reach out to me on either of those. But if you're a business owner or a leader or of an organization, find me on LinkedIn. But all of my handles are / Dr. Maisha, whether you're Facebook, Instagram, TikTok, YouTube, or LinkedIn, it's / Dr. Maisha. If you want to learn a little bit more about the topics that I speak on, the workshops that I run, the course that I have that's designed for organizations, you want to go to mindremappingacademy.com. And of course, if you're in the conversation for creating a thriving workforce, if you're in the conversation for increasing psychological safety and well-being in your organization, then I would love to have a conversation with you if you're a leader of an organization.
So there you have it. Get in touch with Dr. Maisha for your organization or for yourself if you
Mhm.
are also someone who needs her help.
Yes.
This has been an amazing episode. I think we'll have you back in the near future.
I'd
Thank you
love
for
that.
being with us. And if you are a listener and you enjoyed this episode, please let us know in your comments. Don't forget to subscribe. And if you're watching us on YouTube, hit that notification bell so that you can get an alert for the next episode when it comes out. See you
Thank
next
you so
time.
much, Dr. Carmen.
Thank you so much.